Our next presenter, is Alaina Elliott, and she is with the NCHS, National Center for Health Statistics, which is one of the centers within CDC. She's collaborated on various standards development projects representing the Division of Vital Statistics within NCHS, and is going to be presenting regarding its BFDR-E. Yes, is next. Nicole, yes?
Yes, and you also might want to also introduce Lori, since they're
going to say the two are going in quick succession, are they not?
Yes, they are.
Then I will also introduce Lori Reed-Fourquet. I've had the great pleasure of working as a colleague of Lori's you're both delegates of our respective countries, US and Canada, to the ISO Technical Committee in Health Informatics. So let's take it away, please, and let's wish us all good luck.
Today we will review the IHE Vital Records Profiles, Birth and Fetal Death Reporting Enhanced, BFDR-E, and Vital Records Death Reporting, VRDR. I'm Lori Reed-Fourquet, consultant with E-HealthSign. I've been working in collaboration with Alaina Elliott, IT Specialist at the Centers for Disease Control and Prevention at the National Center for Health Statistics. Today we will review the IHE Vital Records Profiles, Birth and Fetal Death Reporting Enhanced, BFDR-E, and Vital Records Death Reporting, VRDR. I'm Lori Reed-Fourquet, consultant with E-HealthSign, and I've been working in collaboration with Alaina Elliott, who's an IT specialist for the Centers for Disease Control and Prevention at the National Center for Health Statistics.
Hi, I'm Alaina Elliott with NCHS. This first slide describes the problems that currently exist with vital events reporting. Vital events reporting includes demographic, medical, and geographic data, which comes from birth certificates, death certificates, and fetal death reports. But the current process requires multiple methods of data exchange between the EHR, the Jurisdictional Vital Records Office, and the National Statistics Agency. And that can mean dual data entry, multiple interfaces, and it can be labor-intensive, costly, error-prone, and can result in issues with timeliness and the quality and usefulness of these data. So the Division of Vital Statistics is one of the divisions within NCHS, and we've been collaborating for a number of years with the National Association for Public Health Statistics and Information Systems, known as NAPSIS, along with state representatives and EHR and vital record system vendors and standards development organizations such as HL7 and IHE to support an EVital Standards initiative. And the goal of this initiative is to develop and implement national standards to support interoperability among the providers and the jurisdictional vital records agencies and NCHS, because we want to improve the timeliness and the accuracy and the completeness of the birth, death, and fetal death records, and to promote standard metrics across all the jurisdictions and the National Vital Statistics System. So in this use case scenario on the right side of the slide, this scenario provides for the flow of data, vital records data from the provider to the jurisdiction, and then the bidirectional flow from the jurisdiction to the national agency. And then finally, in the case of death reporting, it shows the coded cause of death and race and ethnicity codes flowing back to the jurisdictions. And this example of a complete bidirectional flow of vital records data using HL7 and IHE standards is currently being piloted in the US, but it's important to point out that this is also applicable to international use.
The technical solution for vital records reporting profiles includes multiple approaches for collecting and communicating the vital records information. We have a document sharing approach for both vital records death reporting as well as for birth and fetal death reporting using a CDA document using that content creator and content consumer you see at the top of the slide. We have a form collection using form filler, form processing, form managers, as is typical with the forms-based approach, for collecting the vital records information using the same forms that are used today. And these forms can be pre-populated using the medical summary for vital records death reporting and leveraging the labor and delivery summary for birth and fetal death reporting. The information source and information recipient you see at the bottom leverages the HL7 messaging profiles, leverages HL7 messaging for communicating information both from provider to the jurisdiction and between the jurisdiction and the National Vital Statistics Agency. The forms-based approach includes a form processor message exporter, form receiver message exporter, which can capture that information from the form and turn that into the underlying HL7 and turn that into the message to communicate the appropriate information. And the form processor CDA exporter and form receiver CDA exporter similarly can take that source information and transform it to a CDA document. The CDA, this year for Vital Records death reporting only, we've also included a FHIR-based approach on the left that allows for a Vital Records death reporting query to be used to collect the death reporting information from the data responder. So the two profiles that we have for reporting vital records are the Vital Records death reporting, which conveys the death reporting information using either pre-population of data from a medical summary from the EHRs to the jurisdiction, messages between provider and jurisdiction and bidirectionally between the jurisdictions and the National Vital Statistics Agency. It includes CDA death reports between provider and jurisdiction or from jurisdiction to the National Vital Statistics Agency, and supports a FHIR-based query for provider-supplied death reporting information. The VRDR, also using these mechanisms, supports the WHO verbal autopsy report. The birth and fetal death reporting enhanced conveys birth and fetal death reporting information using pre-population of data from the provider to the jurisdiction, and that leverages the labor and delivery summary for pre-population. It also includes messages between the provider and jurisdiction, and then bidirectional messages between jurisdictions and the National Vital Statistics Agency. It includes support for CDA reports of birth and CDA reports of fetal death between the provider and jurisdiction, and from the jurisdiction to the National Vital Statistics Agency. And it supports the WHO statistics for prenatal data, labor and delivery data, and newborn fetus data.
So in summary, this last slide just highlights the value of establishing the interoperable electronic exchange of vital records data between the EHR and the jurisdictional vital records offices and the national vital record systems. We believe that this will promote more timely data release, higher quality for demographic, epidemiologic surveillance and research, improved efficiency for electronic exchange of vital records information, greater integration with other stakeholder electronic systems that might want to use this data, greater standardization of electronic vital records data collection and exchange, and finally, it'll promote consistent statistics between the jurisdictions and the national vital records offices. So thank you all so much for your attention, and we look forward to working with the implementers of these vital records profiles. Thank you. Have a great day.
I have to say, and this is for my colleagues on the QRF committee, they know I'm like a dog with a sock on this particular topic. I'm very happy to see that, that both of these profiles can be used to satisfy the WHO requirement. And I know that right now the uptake of these profiles is generally within the United States market, although there are certainly interests from other OECD markets. I think the fact that it supports the WHO's requirements means that it might be, I think it might be a good idea to develop a white paper to say how these can be leveraged to do the WHO reporting, because that's something all countries have to do. And you know, that's the sort of work that some of us in the committee do in lower resource settings. And I think that really opens up the door for some broader uptake of these profiles, which I'd very much like to see. Thank you, everybody who presented. Thank you, everybody who attended. We had a really good showing, and it was very gratifying to have so many people interested in QRF and in the work product. Thank you.